Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to AMGA's Filibuster and Fine Print, our public policy podcast. And as always, not as always, I'm Chet Speed. I guess I am always.
I would hope so.
Yes, and we are here with.
Who are we?
Why are we here?
Right. Yeah. Very okay. Good start. So here with the expert panel, minus one. But let's start with who's here.
Sure. Hi, everybody. My name is Daryl Drevna. I'm the Senior Director of Regulatory Affairs at AMGA.
Alicia Sawyer, Government Relations Assistant.
Jamie Miller, Senior Director of Government Relations.
All right, fantastic. And who's not here?
Sure. We're missing our colleague, Lauren Latney, who is doing her civic duty as, what is she doing?
She's a grand juror.
Grand juror.
Not a regular juror. She's grand.
She would tell you
very on brand for Lauren.
She's learning a lot about our justice system. It's nice.
Mm-hmm. Yeah. Well, my wife was a prosecutor for 25 odd years. There's a lot of stories going on. Before we start, I want to talk about the impact that this podcast has. So just last week, we talked about thank you notes. And what did our producer, Mike Guy, do today? He gave Jamie a thank you note for a bottle of wine he gave him last week. So see, this podcast has wide-ranging impact, and we're proud to be here.
We're
and
making
thank you,
a
Mike
difference.
Guy.
Thank you, Mike.
And we'll all give you thank you notes for saying thank you to Jamie.
It's going to be a complete process. Yeah. Cyclical. We'll keep writing.
Absolutely. So that's good.
Then a fruit basket.
I'm proud to be part of this group. Okay. So today we're going to talk about the Centers for Medicare and Medicaid Innovation, CMMI. This is going to be a very heavy regulatory / Daryl podcast. And because of that, we do have 3 or 4 pages of notes that he gave us to make sure we cover everything. So thank you, Daryl.
Sure, we'll cover none of it, right? We'll get off on this tangent and start talking about ledge stuff.
Well, Jamie and Alicia are here, so there'll be some ledge to be sure. But let's start talking about CMMI. So there's a new direction at CMMI, and there's some potential implications for our members.
Yeah, I wonder if everyone knows what CMMI is and how we got here.
Yeah, so CMMI was founded or created with the goal of transforming the U.S. healthcare system through value-based care and promoting value-based care through testing new payment and service delivery strategies to improve the quality of care for patients throughout the U.S.
Part of the ACA too, if I remember correctly.
That's right. It's part of the ACA. And I guess they've got a new director, Abe Sutton, who's been, I guess, just a couple weeks now.
Yeah, Abe is served in the first Trump administration. He's been around healthcare policy in D.C. for a while. He left D.C. a couple years ago to go to law school and came back. And also about when it comes to ownership of the CMMI, it started in the Affordable Care Act, which means it's more of a Democrat thing. But I would say that a lot of Republicans, when Trump was in charge, they used it as their own incubator for value-based care design. But yes, Sutton, he worked for the Domestic Policy Council in the first Trump administration, National Economic Council, worked for McKinsey and Company. So he has a track record of working in value-based care. He also started some companies to enable primary care physicians, and he also promoted enabling a company to enable neurologists called Evergreen Nephrology. So he's been around.
Okay.
Yeah. And then he sort of made headlines, I guess, last week with this new strategic direction that Chet was just mentioning. And really, I think the big thing, and we'll talk about their new direction as part of the Make America Healthy Again strategy and everything that comes under that headline, is CMS is backing away from its goal of moving 100% of Medicare beneficiaries out of fee-for-service and into a value-based or a high-value care model by 2030. And we've been talking about that. Which is
when I go into Medicare.
Right.
Just to let that out there.
2030. Huh?
Alicia's looking at me like, oh my Lord.
Wow.
Yes.
So we need to fix this
Someone
program.
needs some help.
now.
Yeah, we do. We do.
None of the changes look back to, which is everything Congress ever does is like, we're going to change Medicare for people below 50.
Good.
So Daryl and I are
So
screwed.
for me, I just missed the wire. Just missed the cutoff. But yeah, no, it was a big shift. We've been talking about that 2030 year for years now. Ever since, I've been with AMGA for about 10 years, and that's that 2030. So that they're backing away from that, and then they've got this new strategic, outline or framework for what they want CMI to focus on, and it's based around these three key pillars: evidence-based prevention, patient empowerment, and choice and competition.
All right. Can you flesh those out a little bit?
Yeah, so first one, promoting evidence-based prevention. This is right up the alley for Secretary Kennedy and I think the Make America Healthy initiative. And it's all about emphasizing preventative health, chronic disease management as basically critical or central components across any of these payment models. They're going to put an emphasis on, nutrition, exercise, behavioral health, early intervention, and it's really, part of that Trump administration goal of, make America healthy again. Part of this is they're going to look into models that are working directly with patients. They're going to try to stand up some models that are working with, that are designed around community-based organizations to address, nutritional needs, or, provide disease management, counseling, nutrition support, and those sorts of things. I think these payment models also, they talked about linking provider compensation under these models directly to preventative care activities and patient health outcomes. So none of this is new. If you're talking about population, if you talk to our members, I think this sounds like a population health type initiative, and I think that's right.
Which we're good at.
Which we excel at, I think. But they're putting it under this new paradigm, this new initiative of the Make America Healthy, and this, promoting evidence-based prevention. So that's, pillar number one.
Okay. And then 2 is patient empowerment.
Yeah, which is something that we at AMGA are working on in our macro task force, is patient engagement and how to get patients more involved in their care and invested in their care. And so this is a real opportunity where we align with the new CMMI goals. And so what they're looking at are initiatives to provide patients with information and tools for informed decision making. And so really helping patients to understand health and the costs associated with it. And so they're looking at shared decision-making tools and providing education to Medicare beneficiaries. So a lot of good stuff.
Okay, that's good. And I know our task force recommendations will come out at some point in the next, in June maybe?
In June, yeah.
Right.
In June,
So
we'll launch our task force recommendations.
Yeah, a whole chapter on patient engagement and empowerment. I think we also talk about financial incentives for patients to remain healthy, which is something I believe CMS Administrator, Dr. Oz also supports. So a lot of overlap between
There's a lot of
us and
alignment
everyone.
here. So I think there's a lot of opportunity for us to take our message from the task force that we're really excited about and have it, align with what CMMI, specifically in CMS more broadly, what they're trying to address here.
Great. And then I think there's also another pillar, choice of competition.
Right, yeah, the third pillar, because they always come in threes, right? You got
The power of three.
Power of three, right?
Not the power of love.
Oh, that's what Huey Lewis?
Yeah, it certainly is.
Oh,
That's
see,
that.
okay, put that on the board.
80s, yeah.
Back to the Future now.
Oh,
Sorry, it is Back to the Future.
No, I just went on but that would be
He was
fun to
in
go.
that movie.
He was, yes. Yeah, he was the
Judge for the guitar thing.
Yep.
I was thinking about Leah Thompson, but that's a different thing.
Yeah.
But-
That is
Yeah.
great cast.
Yeah, there you go. Anyway, choice and competition in CMMI models. What was one of the takeaways from when Mr. Sutton was talking about this was the desire at CMS to pull in and engage with practices that historically have not participated in CMMI models, specifically independent practices. So what they want to do is provide some, advanced shared savings or prospective payments to incentivize and support the ability of independent practices to, be part of these models. Also, to help drive competition, CMI is going to allow a longer timeline or time frame for the collection of losses from participants, so they'll stretch out over a longer time period. And they also want to, remove financial barriers for entry, like I was talking about. So, without relying solely on retrospective payments that, may not be available till, a couple years later, that can be really difficult for a smaller practice to, take on the risk associated with these models. So they're trying to address that. And I mentioned risk specifically because these new models, I think, are going to have an emphasis on downside risk. They spent a lot of time talking about how we're not going to move forward in value. So even though CMMI and CMS are backing away from that goal of 100% of fee-for-service in a value or high-value a value-based model by 2030, they still want to move toward, that's still a goal. They still want to move the system towards that. And they don't see as upside only or one-sided models as a way to do that. So they're going to have models that include some sort of aspect of downside risk. Now, I should say they stopped short. They didn't go all the way to say you are going to be mandated to participate in a downside risk model. They're not there yet, but they came up right up to the line of saying that. So I would expect that any new models coming out of CMMI in the future are going to have some sort of element of downside risk. That's something you're going to have to be prepared for. So yeah, that's the three pillars.
Okay. I had a question on CMMI in general, Daryl. Why is it relevant? You're saying they can potentially force our members to go towards downside risk. They're suggesting things that CMS may do. Congress follows them. Why is it relevant in the first place? Why should someone in Paducah, Kentucky care about what CMMI is doing?
Do you mean as a provider or as a patient? I can take it.
The word provider.
Provider, yeah, because eventually, I think there's a recognition that if you take a step back, why are they doing this? They are looking to wring savings out of the system. They see they consider that we're overspending on Medicare, we're overspending on Medicaid, and they are looking to clamp down on how much money is flowing out of these public payers and into how much we're paying for healthcare as a nation. And so one way to do that is to push the risk off the government books and onto the provider. Right? Okay. And that's really what this is all about, is having the provider take on some of that risk. So it's not just, this is probably too broad, not just a blank check from the government to fund healthcare.
Yeah, they're more than an advisory board like MedPAC.
Oh,
they have real authority.
Yeah, they have real authority.
What happens at CMI is very important to our members.
Absolutely. Yeah. So, they have had some mandatory models, and they're usually based on a specific condition, maybe a bundle around like a hip and knee replacement, that sort of thing. Usually they're hospital-based services that they've done mandatory bundles. But this, at least in this announcement, and things shift. As we're very aware here in DC, things can change. But as of right now, like I was saying, they're right on the line of mandating participation and downside risk, but they're not quite there yet. So you're still going to have an element of voluntary participation.
Okay. All right. And so downside financial risk is obviously a big component of what they're thinking about at CMMI. There's also some efforts around standardization. Is that right?
This is all about interoperability and quality measure alignment and making things easier for providers to participate, especially those independent, smaller rural practices. And this is something, if we're talking about our macro task force, this is something we talked about a lot. How do we get these folks engaged in participating in the system so those patients that rely on those providers aren't left behind from all the advancements that are going on in healthcare.
Yeah, and I think it's standardization of quality measures is something AMGA has been pushing for a long, long time. We have our own measure set. I think it was 14 measures.
14 value-based
right?
measures, yeah. 2018, I want to say we did that. So yeah, we've been pushing that for quite a while.
And CMS moved to a similar concept with the Universal Foundation. Is that right?
Universal Foundation, that was put out in one of the Medicare Advantage rules a little while back, and they've been working that issue. I think our concern is they're looking at that more of as a floor. Instead of a cap, instead of a ceiling.
All right. Well, and we will keep pushing that. I know standardizing these quality measures has been a big issue for the members for a long, long time.
Yeah.
And it sounds like there's some, to use your word, alignment also around that topic with CMMI, Enterprise CMS. So a lot of our members are Medicare Advantage.
Right.
What are the implications of this new plan for that?
So I think they're going to do a lot of work in the MA space. We've already heard some rumblings about bringing back the VBID, value-based insurance design. That was a Medicare VBID. It's back. If we're going like 80s movies again, was it Night of the Living Dead? It's it never goes away. It's going to be pounding on your door until you
Do something.
Do something, right. Thank you. I think, we talked on previous episodes about Dr. Oz's interest in Medicare Advantage and using that as a platform to expand coverage. So I would expect CMMI to start pushing out models that involve Medicare Advantage and Medicare Advantage beneficiaries.
Okay. And we talked about this before we started recording. This is risky business.
It is.
Right?
It is.
Daryl?
It is. So
the title of this podcast.
Risky business.
Yeah. Do you want to expound on that?
Oh, I'm blanking on my joke.
Don't
leave those old models on the shelf. Yes.
For all you young people, that was the Risky Business song.
Risky Business
that
song,
Tom Cruise danced to.
Yeah.
Which Daryl's very, very excited to tell the whole podcast
and then
community.
I just flubbed it.
You did. That's why you're a red guy.
That's why I'm a red guy. You're standing in the batter's box and swinging the miss.
Now Alicia knows why people in their 20s dress like that for Halloween, right?
Yeah, it's a popular Halloween costume. Just the button-down white shirt and the sunglasses and socks.
Good golly. He's not wearing that. My daughter.
Popular for people who have never seen the movie, yeah.
Is that true?
Blows me away.
That can't be.
Here's this thing I've never heard or seen, but let's do this. Yeah.
Everything repeat. So I know the ledge people are dying to jump in here.
Oh, yes.
So, Jamie, at least, the need for congressional oversight. What's that issue?
Well, I think I mentioned in the beginning, this is a Democrat. The Democrats passed this, the Affordable Care Act, so it's not always liked as much by the Republicans. But when this passed, the Affordable Care Act, it was estimated to save over $80 billion over 20 years. But in 2023, the Congressional Budget Office came out with a report saying CMI spent $5.4 billion more than it saved in its first decade. So I think the Republicans are concerned, and back to what Daryl mentioned, mandatory versus voluntary models, I think the CMI of new is going to look into more ways to save money, and also they're going to look into more ways to save money. So there's been a lot of concern, but that's why the new people in charge are interested in that and the budgetary impact of healthcare policy.
And one of CMI's founding goals is to reduce costs for the federal government. So,
which
it hasn't yet.
It hasn't, has not. Yes.
Which is not yet.
So, any stakeholder, not shareholder, thinking of Tesla, any stakeholder responses so far from this new shift?
Yeah, no, I think organizations like ours and our members are still trying to parcel out what this means for models they're participating in. I know CMMI has announced that some of these models are going to go away, like primary care first and making care primary are going to phase out. I think ACO REACH is phasing out, and then you've got this shift in direction. So. I think we hear from our members it takes a long time to learn how to participate and provide, deliver care through one of these value-based models. So now we've got another shift. So it's going to take a while to figure out what the appetite is to participate in whatever models that CMMI pushes out. And you can't look at this in isolation because you've got these larger budgetary pressures going on. So I think there's going to be a wait and see approach from our members to see what the willingness is to engage with CMMI on a specific model. Now, that said, I think they're going to be very excited to go in and talk to them about, patient engagement. And those 3 pillars, those really align with what we've been talking about for a while. So I think there's some opportunities there.
Yeah, when you think about who can excel in this new concept around value models, it's probably AMGA members.
I think so.
Who have the infrastructure and the clinical expertise to do all these sort of things. Okay, so this could be exciting for the members going forward. We have spent 19 minutes on a reg issue, so I think we're going to wrap this thing up.
Yeah.
But thank you so much for being here. This is So Not Delulu, and you all have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.